What is the Institute of Healthcare Model for Improvement? This model, also known as the Plan, Do, Study, Act, is a method for testing a change in the real work setting by planning it, trying it, observing the results, and acting on what is learned. This is the scientific method adapted for action-oriented learning. Here are some more details. Making your plan. After you've had a chance to do your literature review, identify your problem. You will need to write it down. These are questions that you need to continue to ask. What do you hope to achieve? What is your improvement goal? How will we accomplish our goal? What intervention will be used? You're going to see some of these questions repeated throughout my samples of performance improvement projects that we've been doing, but it's important, again, to keep everybody focused and on track. Step 2, the do. Develop interventions or countermeasures to improve the process. Again, how will this be accomplished? You have to think of these details. Determining start dates and ownership for each intervention or countermeasure is absolutely necessary. If you don't have these start dates and you don't have people assigned to be responsible for these interventions or countermeasures, they're probably not going to happen. Outlining specific steps in the process change and who will be responsible for each task is extremely important. How are you going to know if your changes are working? You do have to study your intervention, and you have to decide who is going to do that data collection and for how long, what time period. You must not forget to communicate your results both internally within your NICU and externally. We made sure that administration knew what our results were. That's a very good practice to follow when you're doing any kind of PI study. Was the desired outcome achieved? If you are doing a PI project and the desired outcome is not achieved, you need to look back and see what did you learn from it, because you always learn something, and what changes need to be made to achieve that target condition. Again, this is part of that Plan, Do, Study, Act cycle. You make adjustments. You modify interventions as needed to achieve your goal or your desired state. Whatever findings you have, you need to adjust based on those findings. Look at the process. Look at the intervention. What actually happened after the process change was implemented? That's when you need to use your measurement tools for tracking your data and outcomes. Again, obtain input from your team to determine what changes or adjustments need to be made. Remember, we're stronger as a team. Get that input from all members to see if something was missed, if there's something else that could be done better. Then determine if additional education is needed. If there are changes made, you will need to re-educate staff to any changes made to that process. And you'll have to have a new implementation date and timeline for measuring. It's part of that continuous process improvement cycle.